So like if you had a group of people that had CRPS and you had a group over here that had their limb was like swollen and red and like inflamed, those are usually indicative of the beginning of like acute CRPS within like the first 6 months. And a lot of studies and a lot of the medication that's out there right now, they're doing one in Italy. It's the only place that you can do it right now is in Italy. That one is for your acute patients. The people like me that are in our chronic phase where our limb looks purple most of the time, it gets cold, significant temperature changes, we still sweat, we're in that chronic phase. But they still have us all clumped together in all of the research that they're doing. So now what they were talking about, which was really great, is they're like, we figured out where our problem is. You know, we figured out that we need to divide you guys even more because it is so different. Everybody responds differently. And through this process the last 4 years, I found that I would often think of those parents. And I would think about their loss of a child. My whole life turned upside down. I'm still trying to figure out what it is to not be a labor and delivery nurse and not connect with those people. But man, they had so much strength and they made it. But I also realized that grief it doesn't have to be just death. That grief can be the total change of your entire life. Like, I thought I was going to be a labor and delivery nurse from the age of 10. And so it was something I really, really loved. I loved connecting with my patients and empowering them. I missed that the most. And then, of course, going through this whole process, I really felt that even the nurses that could have helped or could have been there to even listen didn't. They didn't reach out where they could have or could have helped me in different, like even no, like you're a nurse, we have an oath, I don't know, I just felt very alone. So when I finally got to the pain doctor, when I first saw the first one, it was almost 1 year exactly after the injury. And they kept talking about chronic back pain. And I'm like, I don't have chronic back pain. That's not why I'm here. I'm here because I have CRPS, because by now, this is what they're telling me, because by now I've already had the nerve conduction test and I've seen a neurologist. But they wanted to give me a lumbar puncture in my back to handle this back pain. And I'm like, but I'm not having chronic back pain. I'm having this other issue. In May of that year of 2023, in that clinic, a PA was in there and he was saying, well, you know, sometimes when I'm doing surgery and I put my head like this, sometimes, you know, I'll get that pain. So everybody kept like reverting it back to like, maybe it's sciatica. And I'm like, it's not sciatica. I basically told them to go fuck themselves because I said, you know, at this point, I feel like unless I agree to the spinal cord stimulator, you guys don't want to take care of me. And he said, well, if you're really in as much pain as you say you are, then you would agree to the stimulator.
That's not going to do anything for you.
This isn't even like you fell through the cracks. The entire system has been complete, like even the clinicians that are supposed to be the ones that are looking out for you, everyone has completely failed you every step of the way. And I'm so angry, and I want to shake the shoulders of the universe right now.
And I was like, who's this jeweled plant hanger? It's like beaded, you know, plant hanger. It's beautiful. And it was like with jewels, not with wood beads. She's like, my grandmother made that. It's like 60 years old.
Oh, wow.
I was like, really? I'm like, I'm going to make that. She's like, you are? And I was like, yeah. So that's what I do. I started making plant hangers, but I use antique or vintage jewelry. And just recently I made a few for families, right, that lost their families. So they gave me necklaces from their grandmother, aunt. And I made 4 plant hangers for them out of this stuff. I've met so many people, like small still. It's just, it's unbelievable the stories that are attached to what I've made so far. So I got roller skates the day I got injured, and that was a dream of mine. I wanted to roller skate. 46 years old. I wanted to roller skate, and I knew I could do it because I was an athlete. That has saved my fucking life. Saved my life. But when I first started to tell my story, I was judged because how could I possibly have CRPS? Well, laboring patients that don't have an epidural, sometimes they walk. They move around when they're in pain. They move their bodies around. That's what I do. I move when I'm in pain and I'm uncomfortable. I move my body.
So you roller skate. You roller skate.
So I roller skate and my arm hurts like a motherfucker, but
yeah,
I'd rather move my body, and as long as I can. This doctor, if I'm going to be in a wheelchair, right now I'm not. And if getting up and moving my body and fighting the pain and fighting the discomfort and what it goes through, I'd rather keep trying to move as long as I can.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at the Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.
Shut up!